here. I am the creator of Move, Conquer, Live. I'm a certified personal trainer, cancer exercise specialist, and a breast cancer survivor. Today I wanted to give you a little bit of education on lymphedema. This is something that I don't feel like our surgeons talk to us about as much as really they should when we need to go through cancer surgeries. And so what is lymphedema? Basically, it's a backup of your lymphatic system, which runs alongside your circulatory system, and it's a huge part of your immune system. So it's going to take all of the toxins and bacteria and all the baddies out of your system. But when we have radiation or we have lymph nodes removed, that can actually really increase our risk, and it increases the trauma to that area, and it can get clogged up, which is then going to cause us some swelling. It can cause range of motion issues, pain, tingling, and it can actually become something that is irreversible if we let it go untreated. So what do we do to avoid it, which is the best thing to begin with? When you go to the doctor and they do your vitals, have your blood pressure taken on the opposite arm where those nodes were taken. If you have to have any kind of blood draws or immunizations, do those on the opposite side. You want to refrain from wearing really tight clothing in those in the affected area of the body. Don't overheat. Clean any wounds or scratches that you might get to avoid infection and an activation, if you will, of the immune system. And do your lymph drainage exercises before you exercise, which is what I'm going to show you today. We're going to run through a warm-up for the upper extremities, and this is going to be for anybody who has had cancer from the waist up. So breast cancer, lung cancer, head, throat, neck cancer, anything there. And your first step is going to be 3 to 5 minutes of cardio. You can do this on a treadmill, on a stationary bike, you can go for a walk. One thing that is really great for your lymph is either a Bosu ball or a trampoline. You can just kind of march it out on top of those, not really, jumping on it, but giving a good little bounce is great for your lymph movement. So if you have access to that, give that a try. Plus the trampoline is kind of fun to play on. So the first step after you get your cardio done is we need to drain any of the lymph that is stuck in our core. We're going to do that with some pelvic tilts and some crunches. So for the pelvic tilts, you're going to come to the ground on your back and keep those knees bent, and we're just going to tuck the tailbone under. Just like that, just a little tuck under. We're going to squeeze those glutes, just a little bit of activation to get all the fluid moving out of our core. We'll do about 10 of these. After you get those done, we're going to do 10 crunches, staying on the floor here. We're just going to lift the shoulders off of the floor. Little baby crunch, not a full sit-up, right? If you've had a surgery that makes it hard or impossible for you to do crunches on the floor like that, you can sit on a chair with a physio ball here against the wall and just bear down on that, and that'll create some of that same movement in your core. So from there you can come up to your feet. We're going to do some shoulder rolls. These are nice and easy at your normal range of motion. We're not really stretching or reaching farther than we need to. We'll go both directions. From there, we're going to do shoulder shrugs, right? All the way up, all the way down. This is one of the few times when a trainer will actually tell you to shrug your shoulders. Full motion, about 10 here too. From there, we're going to do some neck stretches, okay? So you're going to have one arm behind your back, a gentle pressure on the top of the head. And you're just going to let that rest here for 20 to 30 seconds. Okay. From here, you're going to move that head down so you're looking under your armpit. Keep that pressure on the back of your head, just gentle. This is going to activate musculature on the side here. Okay. We'll make sure we do both sides. Here. rotate that head. I'm going a little faster than we would in a normal warm-up. And then you'll want to do both sides going down here with both hands. Tuck that chin under. Should feel this in the back of your neck. Next, we're going to do some scapular warm-ups. You're going to start with, you're going to goal post your arms, pull those shoulder blades together. Make sure that we don't have a lot of extra extension in the back, right? Just going to pull those shoulders back and focus on a big, deep exhale. Let that relax. Do it again. Okay. This feels really good on the chest. It's good on the back. One more. Next, we're going to come down the center, and we're going to push those hands together in a prayer position here. Same thing, we're going to exhale real deep. We'll relax that, press together, relax. So this is a really great one because it activates your pec minor, which is sort of known as a lymphatic pump. So that's a great one to do. Lastly, just a few things where we're going to let gravity help us out. We're going to make fists overhead, do some circles, right? Go both directions. Do about 10 each way. We're going to do some hammers from here, right? Back and forth. And then some pumps, where we'll pump those hands. Let that hand really reach and really squeeze when it's overhead. And that's going to keep all of that coming down toward the lymphatic system and then through it, so that when you get started on your exercise routine, you're not going to have an excess of fluid where it doesn't need to be. So from there, you're good to go, ready to finish your workout and any other warm-ups that are appropriate for the workout that you've got planned. Stay tuned, I will be doing another video on a lower extremity lymphedema for those of you with cancer from the waist down. Thanks so much for watching. Have a blessed day.